Hi guys, and welcome back to our channel. Today we are here with Kennedy Hostetler, who is a Butler pharmacy student. Keep in mind, guys, if you have taken this course in the past at KLR, or if you are a current KLR student, important to remember, pharmacist and pharmacy technician are completely different, and a pharmacy intern is even a little bit different. And that's kind of what we're going to talk about today. Remember that pharmacists go to school for 6 years to become a pharmacist. And so we are going to ask Kennedy some questions today and get some insight as to what that looks like. So if you are interested in advancing your career from pharmacy technician to pharmacist, this is a great interview to listen to. Kennedy, thanks so much for being here today.
Yeah, thanks for having me. I'm excited.
Yes. So let's jump right in. What made you want to become a pharmacist, and when did you start working towards that goal?
So I always knew I wanted to be in healthcare, like helping people. But to make it simple, I knew I didn't want to have to touch people, like do surgeries, things like that, give physicals. That's not for me. So I always thought that pharmacy was a career that wasn't really talked about very much. So once I actually got into it, it was really interesting. But what started it was really just wanting to be in healthcare and wanting to see what I could do. I came out of high school, went into college, not really knowing what I wanted to do. So when I think it was like my sophomore year of undergrad, I went to I applied to CVS, see if I could try out pharmacy before, of course, I went to like my graduate school, and I decided I liked it. So that's the path I went.
That's awesome. So you didn't come directly out of high school, like with a plan to go into pharmacy?
I did not.
Very cool. Okay.
Yeah.
That's awesome.
Yeah.
So what are some of the things that you did ahead of time to prepare for pharmacy school? You said that you got that job at CVS once you decided that you were interested. Were there any other things that you feel like played a role that you were like preparing for?
I know I did, because once I knew I want to do pharmacy school, I tried to do some like summer classes just to sort of get those gen ed classes out of the way so I could focus on my like pre-pharm classes. I did, our university or our college had like a pre-professional program. So it's for anyone that wanted to do like pre-pharmacy, pre-med, pre-nursing, PA, whatever. And it was just a way to like get your CV in order and look at what classes are needed and things like that. Just get that experience.
Awesome. So
Yeah.
for those who might not know, what is CV?
Oh gosh, is it, it's basically a bigger resume. So your resume is like a short, just like tells you what jobs you've done. A CV is more if you're doing like bigger jobs. So if you have any like projects or presentations you want to add on to it, or awards or things like that, that's a good place to have that.
Very cool. Very cool. Can you give a brief overview of what pharmacy school looks like and the demands that kind of come with it at Butler?
Yeah, so at Butler, so like I said, I didn't go straight into it out of college. So what you can do is do 2 years of like a pre-pharmacy program. So that's where you do like your gen eds and normally like anatomy, things like that, just like learning about the body. And then you'll go into those 4 years of your professional program. That's where you learn more about like the actual medicines and how they work and things like that. But I went ahead and got my undergraduate degree first, and then transferred into Butler. So if you transfer in with a degree, you could just go straight into those 4 years of professional program. So yeah.
That's awesome. You live on campus?
I do not. I decided to live with family to help save some money.
That's awesome though. So you can live on campus at Butler, guys. Or obviously you do not have to. So that's pretty cool.
Yeah.
How much time would you say that you spend at campus? Do you do other activities there? And how much time are you there doing classes? How many classes are you taking?
I believe like we have the normal 16 to 18 credit hours a semester. So you're depending on, of course, the schedule, because since the program is very like scheduled, I guess. Every year they basically have the same schedule, so you sort of know what you're needing to do. But you could be there from like 8 to 3, 8 to 4. Like, it's not awful. There are some days that you might not even have class or just have one class. But it is nice to sort of have those breaks, because pharmacy school is a lot of studying. It's a lot of book work. So it's nice to have those breaks.
Good, good.
Yeah.
I bet it is nice, because I know that the pharmacists I've talked to and have seen, like, going through their rotations and going through their finals and things like that, it's a rigorous program, and they're really working their tushes off for that.
Right.
I know that there are like 3 big pharmacy schools or places where you can go for pharmacy in Indiana. So Butler, Purdue, and then Manchester, right? Are there any others?
Not in Indiana.
Okay, that was what I thought. So what is the difference between a pharmacy technician and a pharmacy intern? Obviously, you know that this course at KLR is based around pharmacy technicians. So I want students to understand really the difference between what a pharmacy technician and a pharmacy intern do.
So pharmacy interns are sort of like right in the middle between a pharmacy tech and a pharmacist. So we only have like a little bit more that we can do than a technician, but a technician is mainly like the customer's first person that they're going to talk to. They can input prescriptions, they can count the prescriptions. I believe they can also do transfers now, verbal transfers. Interns, we can take prescriptions from doctors. We can take them from voicemails. I think technicians are allowed to count like controls and everything. Technicians are allowed to do vaccines now if they get certified, if they want to.
Yes. Are you
very
certified?
helpful.
Are you doing that?
Yes.
Awesome. So interns do that too. So I feel like you really explained it perfectly. Like, they're right in the middle. It's another go-to for the pharmacy technician as well, that intern. And I feel like interns play a huge role in the pharmacy, especially hospital pharmacies, where they really take on a lot of projects and a lot of overhead during their breaks and their summers and things like that. So it's really cool.
Yeah.
What are some of the roles that you have had as a pharmacy intern?
So, I mean, the biggest thing, I think, like the difference between a tech and an intern is that we're able to counsel. So a technician's technically not allowed to counsel a patient, like if they need a recommendation or something like that. So that's the one big thing.
Yes. So we talk about that in class, you guys. If you have taken this class, if you are currently taking this class, we have talked about this a million times. It is very important to understand your scope of practice as a pharmacy technician. And as a pharmacy technician, we cannot recommend, we cannot counsel, we cannot advise, anything like that. But what Kennedy is telling us is that an intern can do those things. So do you have to do that under the supervision of a licensed pharmacist, or do you have to like stand next to her and do that? Or can you just do that kind of on your own?
No, we're able to. I think not many people that I've met, like if there's something they don't know, they're not going to recommend it, or they're not going to, like, of course, give a recommendation at all. They're going to ask the pharmacist to be like, I just want to double check, or I'm not sure, can you help me? But they do not have to be like right behind us. We can give that recommendation if it's one that we feel comfortable giving. Yeah.
That's awesome. That's really awesome. So what are some of the other roles you've had as a pharmacy intern? So places that you have worked, things that you specifically do.
So places I've worked at CVS for almost 6 years. So that is one place. I actually started as a technician, grew into an intern, and we'll see what next steps are. But I've also I work now at a compounding pharmacy. So that's a little bit different. Technicians there are able to compound. They're able to compound really anything as long as they have like the certifications and that kind of stuff. But I also, during one of my rotations, I was at Trinity Free Clinic. So that's a great place to volunteer. They really just have volunteer like doctors, dentists. It's a whole place of great interprofessional interaction and just shadowing a whole bunch of different people. They technically don't have a pharmacy, it's just a medication room. So the prescriptions that you get are a little different than if it was at a pharmacy, things like that.
But still using those skills there. And that is
yeah.
how Kennedy and I met you guys. And we met there when KLR got to go visit Trinity Clinic. And we were just really thrilled with what they're doing there and what they're offering there. I think it's a really, really great program. And that is how Kennedy and I met. And Kennedy was there doing what were you doing, like a summer volunteer thing, or was it a rotation specifically?
Yeah, so it was actually just a rotation, and it was we get options for certain rotations, and it was like an elective underserved clinic rotation.
Yeah. That's really cool. That's really cool.
Yeah.
So what type of setting do you want to work in as a pharmacist, and why? So where do you want to end up?
I will probably end up in retail. My rotations in the hospital, they've been great. I've learned a lot. I love that patient interaction, and the patient interaction kind of lacks in hospital, which is fine for some people. That's great. And I also didn't want to do a residency or like extra schooling to be like a specialized pharmacist. So retail is probably where I'll end up. I'll probably try and stick with CVS and my compounding pharmacy just to have that like exposure to both worlds and have that experience and everything.
That's awesome. I want to jump right back to that compounding pharmacy. I meant to ask this earlier. So the compounding pharmacy, are the technicians making what kind of compounds? Is this like lozenges and creams and ointments, or is it deeper into that?
So the one that I work at, we're just non-sterile. So it is lozenges, suppositories, capsules, creams, things like that. But even like in the hospital, there are technicians that are able to compound like IVs and IV bags and things like that. Yeah.
Yes. Yes, we talk about that a lot. Good points. Why do you think pharmacy technicians are an important role in a pharmacy? So you're a pharmacy intern, you are clearly going to be a pharmacist, you understand the importance of having good technicians, but why do you think they're important? Like, what are they doing that's important? Kind of give your view on that.
So like I said before, they're normally our patients' like first face that they're going to see. They're amazing. They like, we have as interns and as pharmacists, like there's things that need to be done, like paying attention to drug interactions and paying attention to all the different types of medications a patient's taking. So really anything that's able to like take something off of our plate is great. And technicians are able to put in prescriptions, count prescriptions, talk to patients for us. Like, it's just a huge help to have those extra hands, and just also another set of eyes, because mistakes can be made along the way. And even though like a mistake can be changed all the way up until it's in a patient's hands. So having those eyes and having more expertise on the prescription, like it's great.
I always say, I believe that pharmacy technicians are like the backbone of the pharmacy. They really keep everything moving along so the pharmacist can really focus on her job. What are some skills that you think are really important for pharmacy technicians to have? Or traits, skills or traits?
Yeah. So when I first started, I was one of those people that never wanted to call people. I never wanted to talk to people on the phone. It was just one of those things you have to get over. And yeah, that's one of the things that I would say, like, you have to be okay with just putting yourself outside of your comfort zone. It's with retail, I mean, it can be like, there are things that people will be upset about. So you do have to sort of mentally know that it's not your fault. Like, there are things that people are going to be upset about, and that's fine, but we're going to do whatever we can to fix it.
I think also remembering that some of these people, they're sick or their family members are very sick. That's why they're there picking this medication up. And I think remembering to be empathetic and compassionate and patient is really important.
Yeah. And I'm one of those people that if a prescription is not covered, I will do anything and everything I can to find the cheapest thing possible. And I feel like that you also need that determination just to be able to see the prescription all the way through, make sure it is like the best that you can give to the patient. So,
and really care about them. I think that's really awesome.
Yeah.
Last question. What advice would you give to new pharmacy technicians or anyone hoping to become a pharmacist in the future? Pharmacy technicians or pharmacists alike?
Be like a sponge, absorb anything and everything that you can. I know medications are hard to remember, names are hard to say, like you just got to get through it. It's fine. It'll be fine. Everyone around you is wanting to help you. They're not wanting to like make you look bad for saying a medication wrong or something like that. Like ask all the questions that you have in your head, even if you think it's not a good one. All questions are great. Be cautious with all of the things that you're doing just to make sure that you got to be detail oriented to make sure there's no mistakes, things like that. So yeah, ask all and any questions.
Yes, definitely. I agree. I think it's really important for pharmacy technicians to remember the pharmacist needs them just as much as, vice versa. And I think that trust and communication between pharmacist and technician is vital. So I think that's really great advice. Kennedy, thank you so much. I'm really excited for the students to see this video. I think that they will be able to take a lot out of it. We have several students who have considered going into pharmacy school after they graduate, and a lot who are just more interested in knowing, further parts about the pharmacy world. And this is really helpful. So we really appreciate you.
Of course. Thanks.
Thank you so much. And we will talk to you soon.
All right. Thank you.